My name's Aaron Kelly, and I'm the president of Inovalon. And I'm really excited to host this LinkedIn Live session to talk about how healthcare organizations are using healthcare data and AI to enhance healthcare outcomes and economics. Now, joining me today are some really distinguished panelists. First, I have Todd Sharp, who's head of healthcare strategy at AWS. Welcome, Todd. And Rajesh Viswanathan, CTO at Inovalon, one of my colleagues here. Now, as you know, this is a live session, so please ask your questions as an audience. We look forward to the discussion. And so to get things started, I've got an opening question for you both. What do you think is the biggest tangible impact of AI on healthcare right now? Let's separate the hype from reality. Todd, what are you seeing?
One of the biggest things we're seeing right now, in addition to clinical impact and the things you think about in patient care, is we're really seeing positive trends with revenue cycle and financial. Healthcare accounts for nearly 20% of our gross national product in the U.S. And so anything we can do to improve that efficiency, to help increase claims processing rates for hospitals that are cash strapped is seen as overall having a huge impact at scale.
Rajesh, what are you seeing?
Yeah, firstly, great seeing you, Todd and Aaron. It's a great point. There is certainly a lot of hype, and most people think of AI as this magical thing that, you walk into the doctor's going to look at you, and the AI is going to give you some diagnosis. That is maybe at some point in the future a thing, but what's happening today is actually a lot more meaningful than that, and you really want to be careful with what you want to go do with the data. So a couple of things that are super interesting that are actually accelerating a patient's path to care is how do we actually sort of speed up the process when the patient walks into the doctor's office and says, I need to go see a doctor. How do we speed up the process of getting that patient past the finding the insurance information for that patient, making sure the patient is covered for whatever procedures need to be done, etc. So there's a bunch of AI that's actually informing that process to speed up how quickly the patient can get to care. In terms of the economics of the process and how do we make that better, we're seeing a bunch of investments around reducing the manual efforts involved in sort of processing of medical records to go determine how much payments need to be made. So as you can imagine, the automation of that is actually going to drive better economics. Eventually, that's going to play out to the patient as well. So really exciting future here.
Yeah, that's really interesting, Rajesh. I agree. Cost savings, so important in healthcare, and there's a great opportunity to take advantage of AI technologies to accelerate that and get patients the care they need faster. So what are some more of those examples where we're seeing customers taking advantage of data to have a real impact on the patient experience? Maybe Rajesh, why don't you get started with this one? Talk about where you're seeing that.
Yeah, one that I find really interesting is, increasingly, patients are seeing multiple doctors. In many cases, they're doing this across networks because they're moving, they're looking at different options as they kind of decide on their care choices. And it's increasingly harder for doctors to kind of go through that process of going and determining, okay, what's the patient's history? What have they been diagnosed with in the past, et cetera. And being able to access that data, all of that patient history from earlier visits they've had with other doctors, etc., at your fingertips is immensely valuable for that doctor-patient experience. Right, and imagine also being able to not just have the raw data, but having some insights based on that data that's being presented to you. So you can actually then kind of do care management based on what you've seen already and what others have seen. So that's one that we're seeing sort of actually making an impact in the patient experience. There's another one that comes to mind, right? There's the bunch of research that's now being enabled because of the availability of data. I was just reading a research paper recently that Harvard published with the data from Inovalon, and that talked about sort of the Medicare Advantage actually showing better sort of results, better outcomes for patients than, say, fee-for-service Medicare, just because it's proving that patient care coordination actually has a positive impact in the outcomes of the patient. So really interesting sort of value coming out of just having more data about healthcare.
Yeah, Todd, what are you seeing in AWS and along the same lines? How data is helping influence patient care and better decision-making?
Sure. I mean, one of the hottest topics today, and it really should have been a hot topic for decades at least, was around social determinants of health. And I think that white paper, what series of white papers with Harvard Medical is really important because it shows the importance of data, right? Data is actually taking what has been a large public opinion about a large publicly funded program that has in some places been cast negatively And it's actually proving that, no, it has better impacts and better wellness capabilities and outcomes over time, both financially as well as from a patient perspective. So I mean, that's one thing. The other thing that I'm seeing is I just want to double down on Rajesh's comments regarding financial viability as well. I mean, hospitals particularly have been hit with 12 to 13% increases in revenue over the last couple of years, but I've seen numbers going between 17 and 22% on their expenses. That kind of an upside down thin margin, if you will, at best, even at scale, is something that's going to be a drag on the US healthcare system. So anything that we can do to use data to overcome that is better. One of the examples I've seen also is indirect patient care benefits, where you may use AI to do image triage, for example, or looking at the data that's associated with some kind of diagnostic. And that triage then allows a human being in the loop to look at those cases that are shown to have higher acuity sooner. That means those patients then are getting into a treatment lab or a specialty diagnostic center or something sooner. That means they have faster, shorter time to a positive outcome. And they also, as a hospital, are using those specialty suites, and rather than having that asset sitting there costing time and money, it's actually producing time and money. So it's better, healthy for everyone, both revenue-wise as well as human-wise.
Yeah. So let's talk a little bit about the source of all this, which is the data. There's been a lot of discussion in the market about the importance of high quality data. That high quality data will drive a more effective and more accurate models and AI technologies. So what are you guys seeing in the market when it comes to the importance of high quality data and the importance of the source of the data? Why is that a really important thing in an overall solution? And maybe Todd, I'll go to you first and then Rajesh on this one. Talk to me about the importance of high quality data and the importance of understanding the source.
Sure. We hear a lot of things, whether it's about analytics or AI or generative AI, we hear a lot of things about how there's bias and there's hallucination. And, there's an old saying, garbage in, garbage out. And we see that at much more magnitude using these new application approaches and technologies. And in healthcare, we're not just in a mission critical business. As you well know, all of your customers are in a life critical business. And because of that, the cost of data inconsistencies or the cost of incorrect data not only impacts the health of a health system or the payers or the entire continuum of care, but also the patient outcomes, if they're looking at HSA spend and other types of things throughout the year. The value of data here in this environment, where each health system might be using the same application, an EMR, for example, but they might be having data in different ways. It's invaluable to have an organization that can actually pull that together into a seamless way so decisions can be made across a baseline that's consistent.
Mm-hmm. Rajesh, how about you? Talk to me about the importance of high quality data in building AI ML solutions.
Yeah, Todd nailed it. I mean, there's no industry really where the data is more significant, just given sort of you're making life decisions based on that data, right? And healthcare, if anything, is hyper local. The care I get in just across the street is probably different from the one I get sort of 10 miles from here, right? The care I got last year might be different from what I get this year, just because regulatory changes, it's a different doctor. There's just such a broad spectrum of differences in the kind of data that are involved. And it's really important for that breadth of scenarios to be represented in the data that you're building models around. Because you get it wrong, you're basing your decisions on small subset of the data, you're going to have a really significant impact. Right? So you've got this challenge with particularly in healthcare around sort of drift of your model. The model that you built 6 months ago is most likely not going to be as accurate anymore. So you really want to be managing that model drift. Another really interesting challenge with this is the source of the data. It's not uncommon, especially in healthcare, to sort of source it from second parties, third parties, where the data has gone through various transformations, right? Like ideally, you want to get to as close to the source of the data as possible. Get the data. Let's say you're sourcing, you're making a decision from an encounter between a doctor and a patient. You want that data. You don't want something that's munched that data and converted it and made decisions already. So the notion of the data being primarily sourced when you go build a model is paramount to getting this right. So that's what makes this a really challenging thing. And it's really, really important for the data to be fresh, to be primary sourced, right? And to be broad.
Got it. So fresh, primary source, broad, those are critical attributes of a data set. So now let's maybe raise it up a level. We've talked a lot about the data. I'm curious to get your thoughts on what are some of the considerations around training and leveraging, say, large language models in healthcare based on that great data. Maybe I'll go back to you, Rajesh, to keep the conversation going. What are some of the things that you're seeing and doing to take advantage of some of these new models in healthcare?
Yeah, large language models are absolutely the happening thing in this space, aren't they? One of the bigger things that are important to consider here is the likelihood of overfitting, right? Like your large language models are going to be, again, this goes back to that point about the data being clean, being broad, and being primarily sourced. It is not uncommon for large language models to kind of like have a set of data that they're making decisions without having considered the breadth of that data. So you overfitted the model and you're making decisions based on that. All of that said, the important thing around, especially in healthcare, is how do you actually validate that data against real world expertise? We haven't gotten to the point where the machines are going to tell me exactly what problem I have and going to go fix it. And even if we have, it's very difficult for the system to trust that, right? Like as in healthcare, where we don't want to go rely entirely on decisions being sort of thrown out without there being an explainability of the decision that was made. So it's super important for that decision to have some scaffolding around it, to be validated in a real world setting by folks that have had some level of clinical expertise. So really, like the way we get this right is, let's go build these capabilities in LLMs, but let's do it with the appropriate sort of scaffold and the appropriate validation from the domain before you apply it into that domain.
Great. And then Todd, what are your thoughts? What are you seeing?
Seeing a couple of things, absolutely, Rajesh, you hit the nail on the head that your data, not only does it have weight and gravity, but it has timeliness, right? The models you built 6 months ago may not be exactly accurate for what would be available today. So I think that time value of data is important, and that's why the accuracy is so critical. But the other thing that we're seeing a lot of is we're seeing not only large language models, but we're seeing a push towards things like model cards, where those who are adopting the models are interested in knowing what the specifications are. Think of it like a baseball card that has a stat sheet on the back of it. What are the characteristics of your model and how does it get to what is the ground truth it's offering? And that's a big differentiator in the market. And the other thing that we're seeing is really a desire to have models trained not only on large language sets, but also on large data sets that are domain specific in addition to. It's that plus one, if you will, that makes the data far more consistent and far more useful in an immediate manner for the masses.
Got it. So it's great to see this, innovation transforming throughout healthcare. We talked about the importance of data, importance of primary source, training those models. It's just really exciting to see this level of innovation and the rapid growth. How would you guys sort of summarize what you've seen so far when it comes to AI in healthcare in the last couple of years? Give us kind of a 50,000 foot view of how things have progressed. And maybe Todd, I'll go with you.
Yeah, I mean, if you look at 3 years ago, very few people in the world knew what generative AI was, or had a notion or had interacted with it. If you look at what's happened over the last year, there's hardly anyone who hasn't at least interacted with it. And I think that's the revolution. It's not so much that generative AI has changed the capabilities or the underlying technologies. It's the fact that it has improved accessibility for people that really don't do prompt engineering, who really are not data scientists. It gives them an interface to make meaning out of deep, rich data sets that normally they would have had to have gone to a very expensive or very scarce resource in order to tap those to get that knowledge out of it. So I think it's an enabling technology, and that was what we're going to continue to see over time as rich data sets continue to improve accuracy and access.
Mm-hmm. Rajesh, how about you? How would you sort of summarize the last couple of years?
Yeah, it's actually quite fascinating, and in my background coming in from the cloud, I've been awed just understanding the complexity of the healthcare ecosystem. It is incredibly complex, right? And so part of that complexity means there's just a lot of operational inefficiencies in the system. And arguably, like, we've been using AI in healthcare or AI and ML in healthcare for a while, but most of that innovation has still been incremental, right? The things that have happened over the last couple of years, particularly with the arrival of generative AI, has really kind of opened up what we can go do. It's kind of like this perfect storm of all of the data being available and these increasingly powerful AI models that are coming in, right? Like, and healthcare is sort of a really excellent domain if we can get it right, of those two coming together to kind of help move things forward. So eventually you will get to that place where, like, maybe there is that magical, like, you look at a crystal ball and it's going to tell you here's what the diagnosis is. But what we are seeing is an acceleration in that like your path to care. How do we get to better care so we can get to better outcomes? But I think, like all things in healthcare, it has to happen with the appropriate care and judiciousness, that we're not going about it too fast and at the risk of kind of risking basically life decisions.
Great. Thanks, Rajesh. And I'm seeing quite a few questions come in the comments, and so I'm going to try to weave some of those into this dialogue. And I think there's a couple of questions that actually hit on this topic. And, you can't really talk about healthcare and healthcare data without talking about privacy and security and the importance of compliance in everything that we do. And so, Todd, I'll start you off with this one, and then Rajesh. Todd, how do you see the role of HIPAA regulations, the role of the importance of privacy and compliance in how we're going to use this data to impact economics and outcomes, and how AI and ML are going to operate in that environment? Talk to me a little bit about where you see that being a constraint, where you see that being a necessary benefit, frankly, or a requirement of the system, and how are you seeing customers navigate that?
Sure. It's a great question, because in AWS's opinion, we often say that the security and privacy is job zero. Before you do anything else, you have to have that. And I think it relates really well into not only HIPAA regulations, but high trust, high tech, HEDIS, all the other measures that we're used to using in the industry. Because without privacy and security, you don't have trust. Without trust, you don't have data integrity. Without data integrity, we don't get to all the values and benefits that we've been talking about. I do see some emerging trends on the horizon. There's an initiative out there called TEFCA, which is a trusted exchange framework and common agreement, a way to start exchanging data once it's been normalized and wrangled. That's going to have impact. And the other thing that I see out of this is that you mentioned compliance. Compliance is not only compliance with a HIPAA regulation through, a shared security model and trust, but HIPAA is also something that, we build patient-centric trust on as well. It's not just between payers and providers collaborating to provide an average of an 18% cost savings in care over the lifetime of a patient, but it's also that data now going through 21st Century Cures Act and information blocking regulations back to the patient and to the patient's family. So it has to not only map with what we understand in the healthcare field in terms of complexity around coding and medical specific terminology, but we have to be able to map that consistent data to something that can go on an after visit summary or discharge orders, or something that can be more human readable so that people can actually adhere to their care plans.
Yeah, Rajesh, why don't you share your thoughts too, the importance of privacy and compliance? And again, I'm filtering some of the questions here I'm seeing on, responsible use of AI in healthcare and the implications of that.
And it is such an important concept, right? Like, I think data in healthcare has always been about, like, how do we make sure that only the data that's needed is provided for. And there's very clear governance around what the use case of the data is, whether it's a treatment use case, whether it's a payment use case, whether it's an operations use case. So one of the fundamental tenets around building AI models is trying to make sure that that is built on de-identified data. So it's really important as models are being built to ensure that, like, the data that's actually being used to build those models is not leaking information, leaking identity or identifying information into the model, right? Like, models can tend to sort of like essentially regurgitate what they've learned, and there'd be lots of incidences where that has been shown to happen. So it's really important as the model builders to make sure that you've actually validated the content, the data that's actually empowering that model, to not have that sort of a bias in the system. And that is the responsibility really for a lot of us in the healthcare technology space to ensure that that's happening. We all share that responsibility, right? And you mentioned responsible AI and ethical AI. These are all sort of like core sort of fundamental tenets and principles that we need to incorporate as we kind of drive faster into the sort of like healthcare and AI sort of coming together bit. I don't think there is an easy solve for this. This is really up to all of us in the industry to get this right. Which is why I think like we have to be enormously careful. The excitement of AI is fantastic. We have to be enormously careful as we go do this in a careful, sort of safe way for patients.
Mm-hmm. Yeah, I would agree with that. And I think your comment earlier, Rajesh, about how having a certified professional at that point of care is critical, and why while AI and ML might help provide, synthesize information and data and perhaps provide some insights based on that data. At the end of the day, as a patient, you're trusting your care provider in front of you to do the right diagnosis and treat you in the right way. And that, I think that, at least for now, that's very important in all these scenarios. Another question I'm pulling from the feed here is around the importance of AI and ML and data in medical research. And so, Todd, share your thoughts on what you're seeing now in the area of research and development, and the importance, of course, data in that, but AI and ML, and then I'll go to you, Rajesh.
Yeah, thanks.
Sorry, go ahead, Todd. You go first.
Let's go, Todd.
So because clinical research is a passion of mine. I had the opportunity to lead a team of clinical researchers in a pediatrics environment for 4 years, clinical research technologist. And, all the statistics and the data that we've been sharing today, and all, whether it's the Harvard Medical Study, that's a form of research, right? It relies on the data. But if you're looking at something that's actually involving clinical research with a human, it's gone through an institutional review board, that data is even more important. And today what we're seeing that 84%, I've seen numbers, 84% of all of our research that has led to therapies or treatment protocols is based on a Western European genetic makeup. Mm-hmm. If you look at that, you think about what is it like if instead of I'm Western European, what if I'm Asian? What if I'm African? And I've seen differences in genomes from Western African to Eastern African because there are different influences there. That can have a huge impact on my treatment and my care plan. So the ability to take those things into account and surface that seamlessly to a clinician could have a big impact on my care. Also looking at whatever community factors or personal factors I may have chosen to share with my healthcare providers can also help me in terms of determining payment and reimbursement rates, because there may be programs that I'm eligible for that without that data there accurately, you wouldn't know that I was eligible for it. That often happens in our senior communities. And as we continue to age in place in the United States, that's going to be a big draw and an important advantage to have consistency. With AI, what we have is the ability to surface those opportunities more quickly to people that may not have their focus on it right away, whether that's a clinician who has been treating diabetics for a number of years, has had all the recent training, but may go to their old go-to therapeutic all the time because it's very inexpensive. They know the payer is going to approve it, so they just keep prescribing it. For this case, there might be a good reason to go for a higher value, more expensive treatment that could have a much better income in some kind of a population. You don't want to put the cognitive burden on the clinicians to sort all that out, and you don't want to have the payers try to sort it out retrospectively. Having this accurate data and generative AI throughout the entire continuum of care helps them get to that answer much more quickly and get to yes, so the patients can benefit as well as the system's financials.
Yeah, I would agree with that. And Rajesh, how about you? As you think about the importance of breadth of data for medical research and the applicability of AI?
Yeah, no, I think Todd's kind of sort of said all of the important stuff that's to be said. The data is what's basically going to decide whether your system is sufficiently anti-biased, right? Like you've got life decisions that are being made based on the data, and it's if that data was trained on a very particular set of characteristics, that's what it's going to go say, regardless of what patient audience you're targeting those decisions toward. So again, this comes back to that sort of responsibility and ensuring that you've not overfitted the models that you've built. to adhere to a certain class of input data, and instead you've actually sampled it again, or you built it against sort of a very broad set of data. So super important point. One of the things that, as technologists, as model builders, these are things that we have to think about day in and day out to make sure that we're actually producing not just decisions, but actually accurate, thought through, and safe decisions.
Great. And so building on that a little bit, actually, this has been a really rich discussion. And so what I'd love to take us now is, let's look ahead into the future. We've got a few minutes left. Talk to me, each of you. Rajesh, I'll start with you. Where is this all going? What's next? What are the key trends that we've seen over the last couple of years with data and AI in healthcare? And where do you see it going? What are the things we're going to see next? Rajesh, you first, and then Todd, I'll get your thoughts.
Yeah, I wake up every morning and I go check. I wear an Oura ring, and that thing is basically sort of like pushing out maybe more data about me in an hour than the entirety of my health data that I had, say, 10 years ago, right? Like this curve is exponential. The amount of data that there exists about our health, it's just exponential. So that's the data angle to this. Then there's the sort of computing power as well, right? Like Moore's law. And that's basically saying that we're just going to have increasingly powerful computers to go have these models against these data. So effectively, between these two things, you've got massive amounts of data, massively powerful computing capabilities, right? These models are going to become increasingly powerful. Now, there's two things that there's two ways this can go in my mind, right? Like if we just kind of let the data and the models kind of run it, right? Like, but if there's no validation of the quality of the data, if there's no validation of the quality of the predictions of the, right? Like we're going the other direction than we should be going. Right? So the two guardrails essentially is the quality of the data that's informing these models, and then the validation of the predictions from these models using clinical expertise, scaffold the results that are being predicted by these models. I think that's basically the direction that healthcare and AI will go as we get it increasingly right. And that's basically how I see this world progressing.
Got it. So broad data sets, powerful models, but clinical expertise at that last mile to ensure patient care is always first and foremost. Todd, what do you see in the future? What's next in this area?
I think Rajesh really laid out a strong argument for what is in the short term and where we're going, and laid out that plan for the long term. But a few of the things that I see is this human in the loop, whether it is with a clinician who is going to get augmented capabilities to then look at orders and opportunities, that clinician still has to sign off on those orders at some point in time at the point of care. I don't think that responsibility and accountability ever goes away. And because of that, there's a human in the loop. Now, over time, for other things, whether that's that scheduling software or the patient financial services or the revenue cycle adjudication between payer, provider, researcher, et cetera, if you're looking at those things over time, I think we will get to a point where there are automated agents, health AI agents, that are going to start acting on behalf of established rules, data within parameters, to Rajesh's point, within guardrails, right? Anytime something's new, a new technology comes out, whether it was breaking open the atom, or whether it was precision medicine or genetics, or whether it is now AI, it is responsible for us to have a human in the loop to make sure that we're double checking, triple checking, sometimes making sure that there are citations. So a human who has a question can look at a suggestion, click through it, and see what the underlying data is, to actually just kind of take a moment and make sure that it's reasonable, rather than just clicking through and saying yes. I don't see that going away at the point of care, because providers are still going to be in the loop. I do see it automating itself in business processes. Look at reorders and supply chain processes, things like that. Look at financial analysis. So I do think health AI and health AI agents we'll see much more commonly from, say, 12 months out to 36 months, taking over automation for lower level activities.
Great. Awesome. Yeah, that's really interesting. So we've got about a minute left. Any closing comments? I'll go Rajesh. Last thoughts for our audience. Very much appreciate people who've attended and listened in. Closing comments, Rajesh, and then Todd.
I think like I said earlier, it's the quality of the data. It's the human in the loop that's validating the outcomes of the data. That's basically where we're going. That's how this gets that's basically what's going to improve healthcare with AI.
Todd, any last thoughts?
Strap in, get your seatbelt ready, because I think that we're going to see so much innovation at such a furious pace continuing for the next several years. It's going to be a very exciting time, but also recognize that there's room in this human in the loop for empathy as well. For some, it will be an unsettling time. You will have patients who have perhaps been disenfranchised, their communities have been disenfranchised in the healthcare system in the past. They may be very skeptical of whether AI is helping or not. It's up to us from the moment we take a question up to work it backwards to a design that becomes a model, that we're looking for bias at each step of the way so we can minimize it, knock it out, and make sure that reliability and ethics are high in delivery.
Great, Todd, very well said. Thank you so much. Thank you, Rajesh. Thank you, Todd, for joining us today. Thank you to our audience here on LinkedIn Live. Hopefully that was an informative 30 minutes on data and AI in healthcare. Again, I'm Aaron Kelly, president of Inovalon, and thank you very much for joining us, and look forward to seeing you again at a future session. Thanks, everyone. Appreciate it.
Thank you.
Thank you.